Welcome, everyone. Thank you to HEI for putting together such an awesome session to review sort of the history and stories of policy and action and their impact on human health. And then just thank you to all of you for being here today. I'll introduce myself. I'm Neeta Thakur. I'm a professor of medicine at the University of California, San Francisco. A lot of my work is on place-based interventions, and so this topic is really, really important to me. I'd like to introduce my co-chair, Ben Barratt, who will be giving one of the talks later this morning or this afternoon. So to kick us off, I thought we could go through a little bit about what is accountability research. And at its most simplistic form, it's did this work, right? This is like, did the policy, the intervention, the regulation, did it actually in fact work? And that's both on the immediate impacts, such as like on the emissions or the air pollutant that we're targeting, but really, what are we caring about? We're caring about its impacts on human health. And more importantly, we want to use those stories to really understand and provide critical feedback to policymakers so that they could use the information that we are understanding from our research to help inform future policies to protect human health. And so we have often talked about the chain of accountability as a framework of approaching this type of research, right? And so this is thinking about the air quality of action that is in focus, and thinking about its immediate impacts on the emissions. How does that impact air quality overall? And then more down the way is its impact on human health. But we all know the reality is it's not that simple, right? It's really a web of complexity that we have to think about. And this is from one of our speakers today, Dr. Ebert, who published the web of accountability, where you're thinking about the policy, but not in isolation, right? There are political factors that are happening at the time. There's the cost of the intervention. There are the implementation challenges. Is this going to actually be taken up? And then there's also the confounding of co-occurring air pollutants or other exposures that may dampen the efficacy that you're hoping to see. And then there's local contextual factors. There's the interaction with poverty, healthcare access, and other factors that are happening on the ground in the local community that may improve or make worse the outcomes that you're expecting to see from the action that is happening at the front. And so when we're thinking about that, and this is courtesy of Dr. Barratt from a presentation in 2013, is like, how do we really capture this real chain of accountability, right? How do we integrate these political forces that might be of play? How do we make sure that the data that we're collecting is accurate and reflective of the thing that we're actually trying to measure? And then how do we measure for confounding or co-occurring exposures and really capture the impact on human health so that when we go to feed back and share back with our regulators, these are the types of actions that you need to make, that they're informed in a way that's useful. And so as you heard, the bread and butter, or the thing that HEI is known for funding, is accountability research. In our website, we have all of the reports from the studies that we have funded in the past. These are some samples from the last decade and a half. And really cool is now that there's a map. And so you can look in your own region or across the states and elsewhere to see what kind of research HEI has funded in the past in this area, and also how that might have influenced some local or federal policies here. And so I'd like to invite our first speaker, Dr. Mark Frampton from the University of Rochester, to talk to us a little bit about the historical policies that have been there and their influences. There we go. It worked by itself.
Yeah, that's Dr. Ebelt's talk, I think. Anyway, again, welcome to all of you for coming, and thanks to everyone involved in getting me invited to speak at this conference. which is a real pleasure. I'm not an expert in accountability, but I have had some opportunities to think about and look into the history of the Clean Air Act, and this was because I was an invited co-author with George Thurston in an article published in the Annals of ATS recently. So this talk is going to kind of follow that article if anybody actually read it. So history and future outlook for the U.S. Clean Air Act. So you've already heard what's ahead in this session. This talk is about the U.S. Clean Air Act, but then we're going to hear about methods in air pollution accountability research from Stephanie Ebelt and from Ben Barratt on congestion charges in London and successes in that area, and then Dr. Zhang impacts of adopting zero emissions truck regulations in Southern California. But for the moment, the Clean Air Act. Now, ladies and gentlemen, I want to reassure you, the Clean Air Act lives, okay? It hasn't been canceled. It hasn't been declared unconstitutional. Congress has not repealed it. So the only problem is it may not be real healthy at the moment. And I'm a doctor, so trust me, I know about these things, but we'll talk about that a little bit. What we're going to do is talk very briefly about the origins of the Clean Air Act and about its evolution, which is a little bit complex. We'll talk about, summarize some of the key provisions of the Act and its subsequent amendments, and then we'll explore whether it actually has reduced air pollution or not, and has it improved health? Now those things are really what this whole session is about. And then what's happening lately? Nothing really, that'll be really short. And then what are the opportunities? Now I'm not really going to explore that. That is hopefully one of the questions for our discussion session. All right, so what led to the Clean Air Act being passed in a bipartisan vote by Congress? Well, there were a few episodes of air pollution. Believe it or not, this country had an air pollution problem in the midst of the last century. Donora, Pennsylvania, in October 1948. Now, Donora was a town with a steel mill and a zinc plant that pretty much worked 7 days a week, 24 hours a day. And you can see in that picture some of the stacks emitting pollutants. The population was about 14,000. They had a strange weather event that happened over several days, which was a temperature inversion, and there are surrounding mountains, some of which you can see in that picture. Bottom line is all these pollutants were suddenly trapped in this valley where Donora was, and daytime looked like this. It looked like nighttime. And then emergency services started getting calls for people in distress. The ambulances couldn't find their way. They had to send people with strong flashlights out ahead of them in order to see. And again, this is in the daytime. People started to get sick. Over 20 people died over the course of the next few days. Something like 1,500 people became critically ill. The hospitals were swamped. And this has been the subject of, actually was the subject of the first big public health investigation in this country. Data over the subsequent decades showed that cardiovascular death rates went up and cancer deaths went up in the subsequent 10 years. So this kind of raised concern. It was in the media. And not too long after, you remember the London fog of 1952, and sort of a similar thing. This was a temperature inversion. In London, there were a lot of emissions from homes burning coal, high sulfur coal. And again, it was bad enough to eclipse the sun, and this is a summary of estimated number of deaths and the smoke level and sulfur dioxide concentrations. There were thousands of deaths in London over the period of a few days, and these smoke, particulate matter, if you will, those measures are in milligrams per meter cube, not micrograms. So that was a lot of pollution and a lot of illness. So that, along with the Monongahela River near Cleveland caught fire, not once, but 13 times. So we could say that's water pollution. We don't have to worry about that. But that led to concerns and legislation, and the first legislation was in 1955. Whoops, never mind. 1955 was called the Air Pollution Control Act, which basically was mostly just funds for research and didn't really legislate or control air pollution. That started with the initial Clean Air Act in 1963, and that was the first legislation for air pollution control. And its subsequent Air Quality Act in 1967, those were pretty much ineffective because they didn't have strong regulation of air pollution. That is what came with the Clean Air Act Amendment of 1970, and that's what most people will think of with the Clean Air Act being started was 1970. It actually was the Clean Air Act amendments of 1970, and that put limits on industrial and mobile sources and had a goal, actually, to reduce emissions by 90% by 1975. That didn't happen, but the idea was there. And in order to make it work, Richard Nixon and Congress created the US EPA in 1971. There have been subsequent amendments in 1977, 1990. We won't go into detail about that, but those were further strengthening of air pollution regulation. Now, what's in the Clean Air Act? First, and importantly, was national ambient air quality standards. The Clean Air Act called for key pollutants to have established standards that, quote, accurately reflect the latest scientific knowledge. So they needed to be science-based. They needed to allow for an adequate margin of safety requisite to protect public health. And cost could not be a consideration in setting the level of the NAAQS. It created a review process, which the EPA instituted. It involved the Clean Air Scientific Advisory Committee, independent scientists tasked with reviewing the science being used by the EPA to establish the NAAQS and find appropriate levels. It also, there was a causality framework that evolved. That's not part of the original Clean Air Act, but the EPA evolved a definition of what are the considerations for determining whether a pollutant is causal for a health effect, which has been very important in the process. And finally, the Clean Air Act involved compliance, measuring ambient monitoring, the implementation protocols, the emission controls, and penalties, financial penalties, and resorting to courts if necessary. And then, of course, accountability was also part of the Clean Air Act. So has it reduced air pollution? Well, the answer is yes, and this is easier question, I think, to answer than has it improved health, because part of the Clean Air Act was to establish monitoring networks for the criteria pollutants. What you see in this picture is the bottom line is the aggregate criteria pollutants beginning in 1970. So the zero line is where things were in 1970 and going up to 1923. And you can see that overall pollutants have decreased. And what the other lines show us is that while the pollutants were decreasing, the gross domestic product was increasing, population was increasing, miles traveled increased. So that's even more remarkable, I think, that despite strong economic and population growth, that the pollutants decreased. This I won't spend any time on, but this is the individual pollutants. You see some decreased a lot more than others, particularly that blue line in the middle, which is sulfur dioxide emitted from coal-burning power plants, dramatically decreased. How about actual air quality? So far, we've just talked about emissions. This is PM 2.5 air quality from 2000 to 2024. We're showing a substantial decrease in PM 2.5 levels. And same for ozone. Now, ozone is seasonal because it's generated by sunlight, but you can see an overall decrease. Now, over the decades, the standards have tightened for PM 2.5 anyway. So the dotted line is the standard that has moved. But you can see now that ozone is actually, the average ozone concentrations are coming into line with the standard. So the tougher question really is, has the Clean Air Act improved health? The EPA looked at this and is required to look at this by the Clean Air Act. It calculates the benefits and the costs of the stipulations and emissions restrictions, and it's always done that by applying a dollar figure to health outcomes. Lives are worth so much, lost time from work, et cetera. And you can see in this table that using the reductions in ambient concentrations and the epidemiology that was available to estimate the number of cases, including mortality and asthma exacerbations, there's been a huge reduction by that method of estimating, a huge reduction in health incidents, including mortality, over the last few years. Benefits exceeded costs by a factor of more than 30 to 1. Now, there's been some changes in the way that EPA is going to be calculating these costs, but we won't get into that at the moment. Now, there have been, excuse me, HEI accountability studies looking at the effects of the Clean Air Act amendments, and these are two of them. I'm not going to go into any detail about them, but these two studies are examples of how HEI-funded research has really helped to refine some of the approaches over the years, and that's continuing, and we'll hear more about that today. So in summary, the Clean Air Act has reduced emissions from point and mobile sources. It's reduced ambient concentrations of key pollutants. It's improved public health. And it's reduced the costs associated with health and welfare effects. This despite robust economic growth and increased miles traveled. However, there's still a lot of people in this country that are living in areas, in communities that are not in compliance with the NAAQS. And that's shown here. It's mostly, the out of compliance is mostly for PM 2.5 and ozone, as shown here. So what's happening lately? Well, again, things have been quiet. Actually, there have been a few things happening. CASAC has been, membership on CASAC has been canceled. I was a member back in 2020. I would think I was the only member that wasn't canceled at that time. Membership was reconstituted. That has now happened again. And there are efforts to vacate the new and tighter PM 2.5 National Ambient Air Quality Standard. There are efforts to terminate the Good Neighbor Plan, which was aimed at reducing pollutants associated with neighboring states. Limits on power plants, emissions rescinded, vehicle standards rolled back, Office of Research and Development at EPA eliminated, research funding grants have been canceled for some investigators, and monetizing benefits of reducing pollutants has changed, and more, but we don't have time to explore that. And it really isn't what this session is about. It's really about, and again, if this just came out in the New England Journal of Medicine, if you want more detail on what's happening lately, what things have been changed, and what their impacts may be, this paper that came out in March in New England Journal, I reference for you. But really, what are the opportunities? Now, I'm going to leave this, but I want to highlight one study that I recently became aware of, and that was published in PNAS in 2022, and it's addressing the issue of exposure disparity based on race and ethnicity, and what are the best ways to ameliorate that. And I won't go into detail because of time, but the bottom line is enforcing the NAAQS turns out not to be the most efficient way to address exposure inequity. The best way is local strategy. So maybe that is one of our opportunities, is in this atmosphere of deregulation, can we change our focus and address some of the long-standing exposure inequities that are not being adequately addressed by the current approach. So I'm going to end there, and we're taking questions later. Is that correct? Okay.
Thank you very much, Mark. And yes, indeed, there will be a session at the end, time at the end of the session to ask all the speakers questions. So now I'm going to invite our second speaker, Stephanie Ebert from Emory University, to take us in a slightly different policy direction. And I don't want to cast any dispersion, Stephanie, but it would be really nice if we could have the clock set to 15 minutes. That would be helpful for all of our speakers. Thank you. Stephanie, over to you.
Thanks so much, Ben, for the introduction, and good afternoon to you all. It's great to be here and to share with you some work that we have ongoing at Emory, Georgia Tech, and the University of Rochester in accountability. And I'll set the stage with just a very broad overview of methods and some conceptual thinking in air pollution accountability to set the stage. So as Neeta introduced, the accountability chain has been a kind of guiding and important framework for accountability studies over the past couple of decades. And these studies, as we all know, the goals are to assess the effectiveness of interventions and to guide plans for future actions. These studies are necessarily very broad in nature, addressing questions on different policies or actions in different settings or at different temporal and spatial scales. So, for example, studies may assess changes in emissions, air quality, or health following either a well-specified immediate local regulation or, for example, resulting from a multi-year national air quality standard. So with this breadth, there's inherently no clear study design classification, and studies will use different approaches or methods to address the policy question of interest. I've appreciated the work by Corey Ziegler and Francesca Dominici, in which they distinguish what they termed indirect accountability studies, which ultimately have the goals of assessing associations between air pollution and health outcomes, very similar to our usual epidemiologic study design, but possibly set within a policy relevant setting. For example, anticipated changes in air pollution levels during a period of the Olympics where traffic changes are expected. And they distinguish the indirect studies from what they term direct accountability studies, which address the question of what is the relationship between a specific regulatory or other action and health outcomes directly. And in so doing, these studies inherently account for all of the in-between factors, and in so doing also are a bit of a black box kind of study. And so one might argue that actually systemically examining each link in the chain may be more direct than going straight from action to outcome. And ultimately, both kinds of studies, among others, are really important within the entire accountability study toolkit. And ultimately, as well, one of the key challenges in all accountability studies are really disentangling what is due to policy. So if we see some kind of air quality change or some health outcomes change, is that due to policy or is that due to some other factors that are happening alongside? A clear and classic example of a setting in which the impacts of an abrupt localized action were studied is that of the Ireland coal bans that you may have heard about. On September 1st, 1990, the Irish government banned the sale, distribution, of coal in Dublin, and other bans in other cities in Ireland were instituted in the following years. Immediate reductions in air pollution were observed. For example, here showing a graph of black smoke levels, you can see that black smoke levels after the ban were about 70% lower than in the years prior to the ban. Luke Clancy, Doug Dockery, and teams conducted extensive investigations of the impacts of the coal bans in a direct accountability framework. So what these studies did was compare mortality rates in the years following the ban. So that's the time period with the green bar shows the post-ban mortality rates. And they compared those mortality rates to a defined control period, which they defined as and identified as the period before the ban. In the Dockery et al. Analyses, the results looked something like this, where they didn't find, in the end, any difference post-ban versus pre-ban mortality rates for total mortality, but they found a significant and considerable reduction in respiratory mortality on the order of about 17%. So this is a really clear example of a setting for an abrupt localized action, and there have been a number of other intervention or what we might say natural experiment studies that have used either similar approaches or other approaches to assess a very clear and localized action. In contrast, as Mark also pointed out, relatively few studies have actually addressed multi-year regulations. For example, those broad policy measures instituted or resulting from the US Clean Air Act. As was pointed out, we've seen an almost 80% reduction in emissions of the six most common or criteria air pollutants over the past 50 years, but attributing changes in air quality or even health improvements from these changes in emissions to any specific policy has been challenging. Take, for example, the last 30 years. Since the 1990 Clean Air Act amendments, there have been a number of policy initiatives aimed at reducing emissions of NO2 and SO2 from electricity generating units, or EGUs, ultimately coal-fired power plants. Numerous other policies have targeted the emissions of criteria pollutants from mobile sources. In addition to these policies that have addressed emissions across the nation, there have been city-specific or region-specific policies that have occurred concurrently. For example, In California, there has been regulations to reduce emissions from port activities, and in New York, there's been the phase out of number 4 and number 6 oils for residential building heating. So for example, if we're interested in understanding the health impacts or air quality impacts of these sets of policies over, for example, a recent 15-year window, the challenge becomes conceptualizing how to assess this given the complicated mix of overlapping policies. So in our group, we've considered assessing the counterfactuals along the accountability chain, and I will call out Ted Russell for the kind of key developer of this approach for our team, Ted Russell from Georgia Tech. Our goal here is to compare what we actually observed happen with policies in place to those happening under a scenario where policies did not come into place, and that's what we call the counterfactual. So our goal is to estimate what emissions, pollutant concentrations, and health outcomes would have been in the absence of selected policies targeting EGUs, mobile sources, and port activities. So in the next few slides, I'll take you through our approach, and I'll give you more of an overview. But we implemented our approach in 3 cities that are characterized by different pollution source mixtures. New York City and Atlanta, for example, have large contributions of pollution from coal-fired power plants and mobile sources, whereas in Los Angeles, there's very little impact from coal-fired power plants and larger impacts from both mobile sources and port activities. So our approach involves 3 overarching steps, with the first one being calculation of impact of policies on emissions. So here we start with actual emissions, and we determined actual emissions using actual measurements of emissions of NO2 and SO2, the National Emissions Inventory, as well as mobile source emissions models. And we compared the actual emissions to estimated counterfactual emissions, and this was a difficult process and involved a few different types of modeling approaches to actually try to estimate what counterfactual emissions would have been in the absence of policies. Here's an example of results, though, on the top here for electricity generating unit emissions of SO2 and NOx. The gray shaded bar on the bottom over time shows that actual emissions have decreased considerably over time, over our study period from 2005 through 2019. And the colored zones show the impacts of different policies, with the overall line showing what policies would have been in the absence of all of the EGU policies together. On the bottom, a similar slide for mobile emissions of VOC, NOx, and PM2.5. Again, the gray shaded area shows overall a declining emissions of these pollutants over time with policies in place. And if the blue and yellow shaded zones show the impacts of the gasoline and diesel vehicle programs, had they not been in place, we would have seen a drastic increase in emissions of these pollutants. Our second overall step was to quantify policy-related impacts on air quality. Here we started with, again, observed concentrations that were measured concentrations at 6 monitoring sites across the 3 cities. We focused on chemical speciation network sites that could allow us measurements of both criteria pollutants, but also detailed PM2.5 speciation and ultimately we also conducted PM2.5 source apportionment modeling. And our goal was to estimate what the daily concentrations would have been in the absence of the policies. So the blank space does involve some modeling, and I'll just do a very kind of quick overview here. But the first step was development of pollutant-specific generalized additive models that linked the actual emissions to the daily observed concentrations, controlling for time-varying factors, and then to use those pollutant-specific models to estimate the counterfactual concentrations using the counterfactual emissions and some other in-between calculations. So here's an example of what the results look like at 3 sites, 1 site in each of the cities, just for PM2.5, but just Ted wanted me to let you know that this was done for all the pollutants of interest at all the sites. So it's a multi-pollutant process that we conducted here. The blue lines show the observed concentrations, so the measured concentrations at these 3 sites. You can see that they are decreasing over time as policies have come into play. And the yellow lines show the estimated counterfactual concentrations, what would have happened without the policies in place. And overall, we calculated about a 27 to 62% reduction in pollution that we can attribute to all of the policies that we've estimated. And then the final step in our process was to actually estimate the policy-related health benefits. Here, we again started with observed health outcomes. Here, again, we're looking at emergency department visits and hospitalizations. We have observed data from state agencies, and our goal was to estimate the counterfactual visit numbers. Again, some modeling steps in between included developing models that linked the observed concentrations to observed visit numbers for cardiorespiratory outcomes. These were multi-pollutant concentration response functions that we then used to estimate the counterfactual visit numbers, and those were compared with observed visit numbers to understand what the impact of policies were. So here's an example of key results focusing in on respiratory ED visits. The results are presented as percent visits averted, so estimates that are above 0 are showing a health benefit where the counterfactual visit numbers were actually higher than the observed visit numbers. The black point estimates for each city show the impacts of all policies combined. We observed about a 2 to 7% reduction or aversion of respiratory ED visits across the cities, and these are due to all criteria pollutants combined. These percent visit numbers translate to about 185,000 respiratory ED visits averted due to the policies over our study period. And I should mention that the populations that they represent are just for populations living within close proximity to each air monitoring station, so they don't actually represent citywide. So we'd expect many more ED visits averted if we're thinking about full cities here. We can also compare policy groups. We saw in New York City a greater impact of EGU policies compared to mobile policies. In LA, we saw a greater impact of mobile policies compared to port policies. And ultimately as well, this study, this 3-city study, was an extension of prior work that was also funded by HEI, where we had developed our counterfactual approach just in Atlanta for a slightly earlier study period. And ultimately, our current Atlanta findings are very similar to our previous Atlanta findings, showing that the results are robust as well. Like any research study, we have a lot of strengths and also lots of limitations. Here, I'm going to just focus on those key, maybe strengths and limitations that are thinking about the overarching approach. We think a key strength of our study is this counterfactual design, where we've directly assessed the impacts of multiple policies implemented over a multi-year time period and impacting the emissions and concentrations of multiple pollutants. But with our approach comes a lot of different modeling steps and a lot of different decisions that we had to make during the modeling, and thus the approach is complex, and of course uncertainties are introduced throughout. We actually did propagate uncertainties from prior models to later models through Monte Carlo simulations, but still there's a lot of decision points that impact probably how exactly the results turn out. And ultimately, another limitation that I think is a limitation of much of accountability research is that we really just don't know what happens without policies in place. We only have the observed scenario of policies in place, and often we're comparing to some kind of a control condition or counterfactual that is really just very difficult to actually validate. So some quick reflections. One is that evaluating the benefits of policies is challenging. I think it requires very good clarity on the question of interest, development of an appropriate study design to actually address that question, and having the available data to be able to address that question, and is definitely advanced by interdisciplinary input and collaboration. From our study, the results suggest that the US air quality policies have been successful in reducing emissions and concentrations of multiple pollutants and averting cardiorespiratory ED visits and hospitalizations. And given the fact that our study really only focused on ED visits and hospitalizations, we can also understand that these health benefits that we're seeing in our study are likely underestimated, given that there's other types of cardiorespiratory morbidity to be thinking about, as well as other long and short-term health outcomes from air pollution that we know are associated with air pollution that would also presumably be reduced with lower air pollution levels. So with that, I'd just like to do some quick acknowledgements. One is to several key collaborators, Dave Rich at the University of Rochester, Ted Russell at Georgia Tech, and Howard Chang at Emory, who've been key contributors to this approach, as well as Ziqi Gao, who was a doctoral student under Ted, who conducted all of the air quality modeling, and Haisu Zhang, who is a current PhD student in our group at Emory, who's done all of the epidemiologic and health benefits modeling. And finally to HEI for funding the work and allowing me to share it with you all today. So thank you.
Thank you so much. Our next speaker is Dr. Barratt, who is from the School of Public Health at the Imperial College of London.
Thank you, Neeta, and thank you to the HEI for the opportunity to talk on this topic area. So I'm going to give you some lessons learned about a long series of traffic management schemes that have been carried out in London from the perspective of someone who's worked in London that entire time and in many cases been involved with much of the analysis.
It seems that we have a technical difficulty. Why don't we skip ahead if the other presentation is already loaded? Sorry. We will actually hear first from Dr. Zhang, who is at the University of Southern California, who will be talking about some emissions reductions and that policy that's been ongoing in the state of California.
Great, thank you. What a surprise. So good afternoon, everybody. I'm really excited to present our research assessing the impacts of adopting zero-emission truck regulations on tailpipe and non-tailpipe emissions, air quality, and health in Southern California. I want to give a shout out to my amazing interdisciplinary team, especially, great, it works. Especially my co-investigators, Dr. Rima Habre, Joe Johnston, Meredith Franklin, and a special shout out to my postdoc, Sarush, who's actively looking for a permanent job. So let me know if you have fun for him. So why are we interested in heavy-duty truck emissions? As we know, it's a major contributor to near-road and urban air pollution. And diesel PM is recognized as toxic, carcinogenic. And in addition to emissions from tailpipes, non-tailpipe emissions from breaker and tire wear also contribute substantially to PM with heavy metals and high oxidative potential, creating health risks. And they also create environmental justice concerns as disadvantaged communities across the South Coast Air Basin, which is our study domain, often experience disproportionately higher traffic-related air pollution. So for those of you who are not familiar with Southern California, the South Coast Air Basin covers 4 counties, Los Angeles, San Bernardino, Riverside, and Outrage counties. It's home to 17 million residents. It has significant economic activities that makes this region very important, but also creating air quality challenges. So to reduce truck-related air pollution, the California Air Resources Board, CARB, adopted 2 complementary regulations. The Advanced Clean Trucks Regulation, which I'll refer to as ACT, requires manufacturers to meet phased goals for percentage of zero-emission truck sales in California from 2024 to 2035. And then the Advanced Clean Fleets Regulation, which I'll refer to as ACF, requires fleet owners to transition to zero-emission fleets starting 2024. However, due to what's happening lately, California withdrew its waiver for the transition of drayage trucks and high-priority fleets. So high-priority fleets are those owned by big businesses. But the portion that's still enforceable for ACF is the portion related to the transition of government fleets and the zero-emission truck sales mandate starting 2036. So this graph here shows the ZEV penetration rates for trucks in 3 different scenarios that we simulated. One is the no ZET scenario, where we don't consider the implementation of zero-emission truck regulations, and one that considers the implementation of the Advanced Clean Trucks, ACT regulation. And the red line here represents implementation of both ACT and the enforceable portion of ACF, Advanced Clean Fleets regulation. So our objective is to quantify the air quality and health impacts of these 2 regulations on not only tailpipe PM, but also non-tailpipe PM, as well as gaseous pollutants like ozone and NO2 in the South Coast Air Basin. We found it really interesting when you think about it. We call them like zero-emission trucks, but they're actually also emitting tail and brake PM. So we're also interested in the contribution of non-tailpipe emissions to primary PM concentrations in the atmosphere. And again, we have an amazing team where my group works on emissions and air quality modeling, and Dr. Rima and Franklin's team works on the health impact assessment and geospatial analysis, and Dr. Jill Johnston's team works on research dissemination. So in today's presentation, I'll focus primarily on the air quality impacts, but I will also briefly talk about the health outcome analyzed by my collaborators. So our group built this emissions and air quality modeling framework to simulate air pollutant concentrations at 1 kilometer resolution in Southern California. I just want to highlight this portion where we developed a high-resolution heavy-duty truck emissions inventory based on telematic data. Unlike the conventional approach, we used telematic data to spatially disaggregate the official California's official on-road emissions inventory to high-resolution 1 kilometer. And we also got the emissions for other sectors from CARB. And all of this emissions inventory were inputted into our WRF-Chem model, which is the state-of-the-science regional air quality model. And we have 2 domains. The outer domain covers the entire California at 4 kilometer resolution, and the inner domain covers the South Coast Air Basin of our interest. What's very exciting to me is that we added tracers to track the atmospheric fate of diesel tailpipe and non-tailpipe emissions, so we can see their contribution to PM concentrations in the atmosphere. And we considered we conducted 4 sets of simulations, one for the base year, 2019, before the implementation of these 2 zero-emission truck regulations, ACT and ACF, and then a counterfactual scenario, which I'm not sure it's going to be the actual scenario during the because of the latest changes in the federal administration. But this scenario, we're now considering the implementation of ACT and ACF for 2045. And we also conducted a set of simulations for ACT and then ACT plus ACF so that we could assess the projected impacts from these 2 regulations. So here are the results. First, if we compare the base year 2019 with 2045, the scenario without the implementation of zero-emission truck regulations, you could still see a huge reduction in PM2.5 concentrations due to the natural fleet turnover and stringent regulations on tailpipe emissions of conventional trucks, and also the emission reductions from other sectors, despite the growth in activity. So the numbers on the top shows the domain-wide average of PM2.5 concentrations. On the left, it shows the base year concentration in 2019, and in the middle, it shows the change even without implementation of zero-emission truck regulations. And then because we separately track the tailpipe and non-tailpipe emissions of heavy-duty vehicles, we're also able to isolate the impacts on heavy-duty trucks. And you can see there's an increase in non-tailpipe emissions, and that's because of the increased activity in heavy-duty trucks. Like the economy is growing, and from 2019 to 2045, we're expecting increased vehicle miles traveled. But the change is relatively small. And then if we compare scenarios, compare across scenarios in 2045, can see that zero-emission truck regulations would additionally reduce PM2.5 concentrations. in most areas in the South Coast Air Basin. So in the middle panel, it shows the impacts of adopting zero-emission truck regulations as compared to the baseline, like no ZET regulation scenario. And here again, we single out the impacts from heavy-duty non-tailpipe emissions, and we're projecting a slight reduction, and that's because of the use of regenerative braking in electric trucks, and that could reduce the brake wear emissions from trucks. And now if we look at the aggregated results for primary PM 2.5, and again, because we're able to trace tailpipe versus non-tailpipe PM in the model, we are able to split this into different sources. I know it's a busy plot, so let's focus on primary PM 2.5 for now. So the first takeaway point is that if you compare the average in the South Coast Air Basin with the average of SB 535 disadvantaged communities, disadvantaged communities are exposed to higher fraction of truck-related primary PM 2.5. And then the second takeaway point is that if you compare base year 2019 with the 2045, even without zero-emission truck regulations, you would still expect a reduction in truck-related air pollution due to cleaner conventional trucks and the emission reductions from other sources. And then ACT and ACF, this zero-emission truck regulations, could further reduce that by 20%. What's also interesting to me is that if you look at this, like primary PM 2.5 contributions from different truck sources. So blue represents tailpipe, red here represents tail wear, and green is brake wear. So in 2019, the dominant process is tailpipe from trucks. But as you go to 2045, because tailpipe emissions will be reduced so much, the non-tailpipe portion will become much more important. And then with the implementation of ACT and ACF, that could further reduce brake wear emissions and reducing the contribution from brake wear, but tail wear emissions will not be reduced due to the limitation of the ZET regulations. So its relative contribution would increase. And similar trend is observed in SB 535 disadvantaged communities. And then if you look at primary PM10, gosh, how should I go back? Yeah, okay. So if you look at primary PM10, So if you look at primary PM10 concentrations, you see a larger fraction from tail wear. We also calculated population-weighted average primary PM concentrations, and the numbers here are higher than if you just look at the area average in the basin, because people typically live in areas where, that are more heavily influenced by truck emissions. And we also look at the impacts of ACT and ACF on gaseous pollutants like NO2. So we found it substantially reduced NO2 concentrations in 2045. For ozone, the impact is a bit mixed, with most of the areas are projected to have a reduction in ozone, but in downtown LA and part of the Orange County, they are projected to have increases in ozone concentrations due to the nonlinearity of atmospheric chemistry. So we provided this air quality exposure data to our health partners, and they conducted first the spatial epidemiological analysis of asthma emergency department visit rates. And this analysis was conducted separately for adults and children. And we found that truck-related PM have these positive associations with emergency department rates for asthma. They tried the unadjusted model and adjusted model, and the positive association remain after adjusting for socioeconomic status and warm season ozone. We also did the health impact assessment, and Meredith, who's leading this, is also in the audience. And we used the concentration response functions from previous HEI reports and the air quality projection from our study. And we found that there would be a significant reduction from 2019 to 2045 in the all-cause mortality in the South Coast Air Basin. And then ACT and ACF could further reduce that. And here are some numbers regarding like how many avoidable deaths could be due to the adoption of these regulations. We're also hosting meetings with community partners to disseminate our research findings and solicit their feedback. And we're also going to publish this ArcGIS story map to provide them information regarding brickware and tileware emissions and how that may relate to their communities. So to sum up, we found that ACT and ACF regulations could reduce PM2.5 concentrations in the South Coast Air Basin, especially in densely populated areas, by up to 0.4 microgram per cubic meter. This reduction is not as big as the reduction from 2019 to 2045, but still, this is the additional reduction. And then the annual PM2.5 concentrations attributable to heavy-duty vehicles are about 70% higher in disadvantaged communities as compared to the basin average. And interestingly, the zero-emission truck regulations could reduce tailpipe and brickware emissions. And because of that, the relative contribution from tileware to heavy-duty vehicle-induced PM would increase in the future. And we also found that ACT and ACF are projected to reduce all-cause mortality burden in 2045. I think I'm pretty good on time, so and feel free to let me know if you want to hear more details about our study. I also have a poster today, and really appreciate the funding from HEI, which enabled me to work with my amazing team. Thank you.
Thank you so much, and we will try again with Dr. Barratt and talking about our traffic congestion.
Hello again. So yes, as I was saying, this is kind of a personal presentation. I've worked in London for the whole of the period shown on this slide. And what's fascinating about London's environmental policies is they've evolved over a number of decades, and it looks quite linear there. The first scheme introduced was the congestion charging scheme in 2008, and that was actually targeting congestion, but this quickly evolved into a whole series of environmentally based traffic management regulations. And it looks linear, but actually no, there was lots of political machinations and all sorts of other issues to overcome throughout that time period, and I'm going to come into a bit more detail with some of those. But I may have interpreted my brief a little too literally, because I'm literally going to give you 5 lessons about these management schemes in London. And the first one I've termed the camel's nose, which is all about being careful what you introduced and what follows on behind, and possibly unintended consequences. So the congestion charging scheme introduced in 2003, it was just introduced in the very central area of London, the most congested area, and it was only during weekdays and traffic hours. And this is because it was targeting congestion and trying to free up the traffic in London to move more smoothly and actually stimulate commerce. And I do remember going into work the day that this was introduced, and this headline from the New York Times really summed things up. It looked like the traffic had disappeared. You could see less traffic on the road, fewer vehicles on the road. And people interpreted that to mean actually the air quality was getting better. And this was not targeting air quality, it was targeting traffic, but people perceived, even back in 2003, that this had a beneficial effect. What actually happened was there was a whopping great secondary pollution episode that week, and air quality got quite a lot worse, but we kept that quiet at the time. But in terms of the chain of accountability, really this was looking at the stages from the introduction of the policy through to the changes in emissions and changes in air quality. And actually the emissions modeling really predicted a significant decrease, that is NOx in that case. But what actually happened? It did cut congestion. But what happened was petrol passenger vehicles, which were being driven at the time in central London, were replaced by diesel vehicles, more buses, more taxis being used. And these diesel vehicles were actually more polluting than the petrol vehicles they replaced. So fewer vehicles, but more polluting. But really what caused the problem was the technology being used in those diesel vehicles at the time. And this was not acknowledged. So the cumulative, the Q-sum chart there shows the cumulative deviation away from the reference mean. The reference mean in this case was the 2 years leading up to the congestion charging scheme. And the fact that we see a sudden change and then the gradient is maintained means there was a step change in nitrogen dioxide concentrations as recorded at the curve in central London, almost immediately following the introduction of the scheme. And this was due to diesel particulate filters being attached to the buses, and the increase in the bus frequency with this DPF technology led to an increase in direct emissions of NO2. Over a number of years, we looked more closely at diesel emissions, others looked more closely at diesel emissions, and ultimately we got to the point of Dieselgate. So what was intended to actually cut congestion, improve environmental quality, in the case of NO2, and actually made things worse. But at least it highlighted a problem with quite a lot of clarity that then subsequently had to be addressed. Second lesson, the ant and the grasshopper. So what really came along after the congestion charging scheme, which was seen despite that bit of a hiccup, which actually wasn't really fully recognized at the time, this was an opportunity to actually introduce legislation that was actively targeting air quality and improvements in air quality. So in 2008, the low emission zone, the first version of the low emission zone, was introduced. And at the time, this was the largest vehicle emissions control zone anywhere. So here was an opportunity to look at whether a policy improved air quality, and the HEI was foresighted enough to actually fund a study to look before the event at what was likely to happen. So the study modeled changes in air quality, highlighted those parts of the city that were likely to see the greatest change, the greatest improvement, inspected what monitoring technology was in those key hotspot locations, and looked for gaps. And that's what the red lines are on that map, and the blacks are the dots. Now, London's got a pretty good infrastructure already of monitoring. But what was recognized was that just monitoring PM2.5, just monitoring NO2 was not enough to be able to apportion or attribute an effect from the policy. So a number of these monitoring sites were augmented by traffic counters, ANPR cameras, so you could see exactly which vehicles were going past that monitoring site and what frequency. Meteorological data, particle number count, black carbon, these real strong indicators of vehicle emission change. So before the effect, monitoring was enhanced, new sites were installed in hotspot locations to really be able to generate and gather the evidence well before the policy implemented. And this really was preparing today. And at the time, it was not known that there would be so many ULEZ and LEZ and ULEZ coming along behind, and these sites have continued to be incredibly useful. They've given a background to much of the research that's gone on in London subsequently around air quality, and there's just a number of examples shown which have been utilizing that foresighted approach to generating evidence. Lesson 3, the boiling frog. I hope you understand what the boiling frog is. It's the idea of that if you put a frog in some cold water and rather cruelly and unethically start to warm up that water, the frog doesn't really notice until it actually boils. So what relevance is a boiling frog? So there's a number of stages that have been introduced in London over the years to the ULEZ, starting with to the low emission zone, starting in 2008. And each one of these has changed the specification, the area that's covered, the types of vehicles that covered, the time period that's covered. And actually what this has gone from a central zone, which only impacted heavy vehicles and was only in limited time weekdays, and actually only targeted to Euro 3 pre-M. That was the beginning, that was the first step. Then over subsequent decade, it's got to the point that by the final stage in 2023 with the ULEZ, only at that point was the whole of Greater London impacted, all vehicles at all times, and right up to a pretty strict standard of Euro 6. So the public had 20 years to get used to the idea of congestion charging, emissions charging, changing their behavior, and then by the time it actually really impacted everyone in the whole of the city, they'd got used to the idea, and it wasn't a shock. So you're not dropping the public into a vat of boiling water, you're just boiling them slowly instead. Lesson 4, there's only 5 lessons. Wisdom listens while noise tries to be heard. So, throughout that period of traffic management schemes, there have been 3 mayors of London. And the political situation has shifted over those decades somewhat. And this really came to a head a few years ago with the 3rd term of the current mayor. And this was around the time when he was wanting to introduce this final stage, this 2023 phase of the ultra-low emission zone, which was really going to impact people living in the outer suburbs, driving their SUVs. And this was reacted to by a proportion of the voting public, and this death of democracy sign popped up. People started, one person actually blew up the cameras, the ANPR cameras that was for fining, and it was really high profile, really quite heated debate. What then happened in the subsequent mayoral election? That mayor increased the proportion of the vote. So even though apparently this was a deeply unpopular policy, which really was the main talking point of the whole electoral campaign, the quiet voters, the majority who were not shouting, actually drove up the proportion. So it was proven to be a popular policy, even despite all of this noise. And this is partly to do with stakeholder engagement. So it was recognized that this was going to be unpopular. So the mayoral team looked to head off any problems, engaging with citizens, giving different campaigns. I would say, being there at the time, this was only partially successful. All of those problems that arose could actually have been avoided if that communication was better. And I think this is an important point, that you need to support technically these traffic management schemes with things like electric charging infrastructure, scrappage schemes, but you really need to engage with your citizens if you want to get that vote through. Finally, don't stop believing. It's probably appropriate I'm last now instead of second to last, because we're talking about good news stories about accountability studies. And in London, this is a good news story. If you persevere long enough, you meet your goals. And it was highly advertised by the mayor that actually in 2024, London met legal air quality limits for the first time, almost 200 years ahead of what actually we predicted, if it did not take bold action. I would like to point out that the government was legally obliged to meet those standards in 2010. And it had been breaching those legal standards for 14 years, but that's better than 214 years. And you can see really quite a dramatic decrease in NO2 there. Once NO2 was seen to be a problem, it was really targeted with some of the subsequent phases. Similar to some of the analysis that Stephanie showed, there was a counterfactual study done to see if the health impacts of these policies could be quantified. And that's the chart on your left, looking at the difference between what PM2.5 and NO2 would have been had these policies not been introduced those years earlier. But that's a modeling study, and what we really want to know, thinking about the chain of accountability right through to its endpoint, which is health improvement, is has the health of Londoners improved as a result of these series of schemes. And this is where the CHILL study comes in. So the CHILL study was started a few years ago, and it used the city of Luton, just outside of London, as a counterfactual, which had not introduced any environmental policies, and looked at the respiratory health and well-being and mental health of children who were growing up in London as these schemes were introduced, and in Luton as these schemes were introduced, and took a number of health outcomes to see if there was a change. I would have loved to have shown you the important respiratory results from this study, because I have seen them, and they're really exciting and really encouraging. But unfortunately, they're still under review, they've not been published yet. But fortunately, the PI of the CHILL study is just sitting over there. So if you want to know the results, if you twist his arm probably quite gently, he'd be happy to tell you the good news of what's coming out of the CHILL study. So to sum up, really, London is a cleaner, healthier city as a direct result of consistent mayoral policy over a number of decades, several terms. And I think this really gives a nice case study that others can use for policy accountability. Not perfect, but it got where it wanted to be. That comprehensive monitoring infrastructure really was essential and continues to be essential for identifying things like unintended consequences, maintaining acceptance of the public as things get a bit hotter, designing effective future phases where previous phases showing something's not being quite as expected as it should be, and policy accountability. Studies focusing on single pollutant, perhaps PM 2.5 is most common, are vulnerable to missing important outcomes, NO2 in this case. We're in this world of skepticism around scientific evidence. So we run the risk, if we poorly design accountability studies, of actually putting something out there which is going to be used against us. And it's possible that these studies can do more harm than good, and this has actually been seen in London as well. Meaningful and trusted citizen engagement is tremendously important, both during the implementation phase and afterwards, to ensure that these policies are equitable. Help understand the drivers of change and the behaviors that these policies introduce and cause. And I think that's something that could have been done a lot better in London. And then a final point that just is my view, integrated accountability studies that consider whole system impacts, not just air quality, are really important to improve an effective public health agenda. So looking beyond air quality to other impacts that these policies have. It might be around exercise and greenness. It might be about quality of life. All of these affected things that are related can help win an argument and create greater evidence. That's where I'll finish. Thank you.
Thank you. I do invite audience members to come to the mic for any questions that they might have for our panel this afternoon. As one of the moderators, I get the pleasure of having the first question, though. And so, Ben, you just spoke about local action in London. Stephanie, in your web of accountability, you include a section that talks about trying to think about the local actions. And Mark, in your first talk that kicked off our session, you talked about opportunities that might lie in local action to have more impact on health disparities. And so I'd like to hear from all of you, what are there opportunities, or where are there opportunities for us to innovate at the local or state level, particularly during a time where we're seeing federal policy step back?
Perhaps if I could start. So in Europe, the thing that's really driven these environmental improvements has been the air quality limit values. And the EU handed down responsibility for meeting those to the member states. And the member states then, in turn, handed them down to the cities and said to each city, you know your city, you do what you think is best to improve air quality. And London was seen as the biggest city with the biggest problems, so other cities were looking to learn from it. But what's followed is a series of really differently designed equivalents of the London LEZ, which suit that city. And a nice case is Bradford. Bradford's not a big UK city. It's a relatively small town, but it's got a very effective ultra emission zone with a very effective evaluations program. So the mayors in those cities and the people of those cities are designing, co-designing the policies, which is driving some real local innovation, I think.
To be honest, I don't have any specific examples that I could share with you. I think Ben kind of summarized it nicely. I feel like if there's local support, local communities that can kind of jump into the equation in terms of pushing a certain agenda forward, I think that's the most important part. As Ben also mentioned, each city is different, has different contexts, different sources, different kind of needs, and different actions could be important for different, you could be more influential in different cities. So I think just including the idea of community input and having really engaged mayors or leadership is the most important.
And I do think in California we have very progressive regulations and incentive programs. So I think we talk a lot about regulations, but the other approach to, for example, increase adoption of zero-emission vehicles or to promote cleaner conventional trucks could be to give incentives or funding. And the other initiative in California is the AB 617, which facilitates community to do their own air quality monitoring and come up with action plans to reduce their local emission and air quality problems. And I feel really fortunate that in this, amid these changes at the federal level in California, there are still a lot of movements going on. And in the city of LA, I think we also have, for example, the initiatives by the ports to transition to cleaner fleets and onshore power. I do think some of the challenges is legally, and I think some of the colleagues from CARB can better speak to that. But we need the waiver from the federal government to implement some of the regulations. But I also feel like we could be creative. Like the South Coast Air Quality Management District, they're supposed to manage facilities or point sources, but they also had this indirect source rule for warehouses where they could also sort of control the emissions from trucks. But I'm not a lawyer, so I cannot speak to how effective that would be or whether that would be challenged. But just to share some of the examples I'm thinking of right now.
So as a second question, Neeta, you presented at the beginning how the chain of accountability is somewhat of a perfect view of how things could or should happen, but in reality things get complicated by implementation phases and others. So how should we as investigators be thinking about those complications in the chain of accountability? How do we create study designs that are able to deal with these complications?
Yeah, thank you. I'd like to hear from Stephanie on this as well. But my background's in implementation science, so it's really the study of how do you go from evidence-based interventions or policies and look and examine how do you implement them in real-world scenarios, which we know never replicate your traditional randomized controlled trial. And so I think when I hear all of your presentations and see these different frameworks, I do think we can borrow a lot from the implementation science world in the sense of studying the process of implementation. And so the two frameworks that come to mind, one is called the Consolidated Framework of Implementation Research, or CFIR, and the second one is REAIM, where you're really looking at reach, effectiveness, implementation, maintenance, and adoption as part of your assessment of the intervention, and not just looking at effectiveness and its longer-term impact. And the reason why I think these frameworks are helpful is actually something you said in your last one, is when we study bad studies, it just contributes to the sort of naysayer arguments that these don't work, we shouldn't be putting funding, or this is not an effective policy. And what we really need are studies that understand why a policy might be successful or fails in a specific setting. And these frameworks really let you do this, because there's things that you can measure on the outer setting, or like the social political sphere, on the inner setting, so what's happening at a local area that allows for adoption to happen, or even at the individual level. And Xiaosei, in your study, you included renter payments as part of your modeling, which I thought was really interesting, but also a really important marker of socioeconomic stress and also differential exposure, right? And so that would be like an individual level variable that may contribute to heterogeneity and the effect that you see. And so I think borrowing some of that field's work here into the accountability research could really improve why something might be successful or not successful. I don't know if you want to add, because your web was really interesting, because it's like, oh, I can see where all of these are.
It's easy to brainstorm a web. I think it's harder to actually, figure out what to do with it. I feel like all of these different links, there's so many different factors that could affect that downstream impact, and incorporating it all into one study seems almost impossible. But I also feel like one of my last bullets was like interdisciplinary collaboration on our studies. We've had atmospheric modelers with epidemiologists, with clinicians, maybe we're missing the implementation science piece, and I think that that's a very, you make great points. I think that those are maybe the next steps, one of the future directions for our studies, like that direct accountability framework going right from action to outcome. We have no idea what's happening in between, and why, if we don't see an effect of an action on outcomes, we just don't know where something has maybe failed or not gone as we anticipated in between. So kind of having a more systematic approach and finding systematic approaches is important.
Great, thank you very much. So now's the chance for the audience to have some questions, and there's a few people at the mic already, so John would like to go.
Thanks. Hi, everybody. John Samet from the Colorado School of Public Health. And for historical reference, I've chaired the original accountability working group at the start of the 21st century. So just a comment. I mean, I'm really impressed by the evolution of the methodology, the elegance, and so on. I think Ben's presentation and Mark's comments really say that another stage of investigation is needed, which is the accountability of accountability research. What is happening because these studies are being done? Do they have force? So I thought from London, what we saw was actually this sort of ping pong in a bit between what was happening and ongoing sort of quasi-real-time evaluation from the Imperial folks and others. So a useful example. But if you turn to some of the other studies, have they made a difference? How do we know how they've affected the policy debate? We have a new incoming chair of CASAC, or returning chair of CASAC, who discusses something called interventional causation. Will the accountability studies have more force than the observational studies that are kind of being kicked aside, as some of you know? So maybe there's a mandate for another diagram on top of the old one or something? The chain of accountability for accountability?
I'm not going to touch that one.
I'm not convinced there was a question in there.
I think it was more of a
Fine one.
commentary, but an important commentary that we need to maybe update our framework for accountability studies. And maybe I provided an introduction to that by introducing implementation science. We can go ahead here with our next question. Please name and institution. Thank you.
Chad Bailey, US CPA, Office of Transportation and Air Quality. In the spirit of being as specific as possible, thank you to Stephanie for mentioning that. I want to ask a question of Ben about what were these buses doing that was causing NO2 problems? And to be specific, in the United States, I can say the other part of the Clean Air Act that's not Title I that Mark didn't talk about is Title II, and that's what my office works on. We set emission standards for motor vehicles. And in 2001, we set emission standards for heavy-duty engines that set stringent standards for both PM and NOx simultaneously. Those did not start phasing in until 2007 to 2010. And your study is talking about, now US and Europe are a whole different regulatory schemes, so this is not the same. But Euro 5, I think, was trying to go into effect at that point. So these weren't things that were meeting the most stringent emission standards. So I'm just going to push on what exactly were these vehicles, because we can't just say that's traffic. This might be something unique that only appeared in London at that time.
Yeah, I can tell you exactly what was going on there, because we looked at it very closely and very quickly. So the intentions were good. It was recognized that more buses were going to be needed, so they tried to introduce the cleanest buses they could find in respect to PM. Those buses had diesel particulate filters on there that raised the temperature to burn off the carbon in the DPF using NO2. And not all of that NO2 was expended in the burn cycle, so it was pumping neat, direct NO2 out into the atmosphere from the DPF. It took, well, several years to redesign the DPF, retrofit all of those buses that had the old DPF in, and to stop them pumping out that NO2.
And the one thing I will say is that EPA, in the United States, we never had, well, Other than the phase-in period for heavy-duty engines between 2007 and 2010, we never really had large numbers of vehicles being produced that just had DPFs and no NOx control, and that was very intentional because we didn't want either people cranking their engines to be as lean as possible, and so avoiding particle traps, and we didn't want people going, essentially getting out of the box. And I'm not sure that Europe fit the box quite so tightly.
That's good. I think I first met you in about that period, so you could have told me at the time, and it would have...
Hello, this is Anarelli Morales from the Department of Public Health and Environment in Weld County, Colorado. So I have several questions that are sort of combined, but I guess I'll tell a short story, which is basically the ozone is not responding as expected in the Intermountain West to the local controls on reducing NOx and VOCs. And it's sort of just kind of stagnating or going up. But so we have this situation where we have controls and they're not doing what we were expecting them to do. Yet the Clean Air Act continues. The clock on those state implementation plans doesn't stop and doesn't allow for any of these awesome studies that you guys presented as examples of, hey, maybe let's see if reducing EGU emissions is better than mobile, or vice versa, or anything else that you guys are presenting. And so I don't know if there's some background that I'm missing. What is the rationale for these SIPs, these state implementation plans, being they're so rigid and so short term? Like you only get a certain, for example, Colorado, we had just submitted a SIP, but then we are still working on the next SIP because there's two separate standards. And so they're just continuously going, okay, what's the next regulation? What's the next control strategy we got to put in here? But we haven't even checked if the previous ones are working or worked. So it feels like this, you're just kind of set up to fail because there will never really be a point where we can pause and analyze. So that's, I don't know if there's a question. I guess the question is, do you know what's up with that timeline? Because that doesn't make any sense. Maybe it did, like, back in the day, but that doesn't work right now.
A really good comment that I don't have a good solution. And I feel California is sort of on the same boat. And also, if you look at like the SIP, there's a so-called like black box approach that if we don't really know what can we do, we classify this like this much of NOx reductions would be needed to attain the standard. And that's depending on technology advancement and also the sources that are regulated by the federal governments, like aircraft or shipping, etc. So I hope for the best, but yeah, I think you had a really good comment. Hopefully we can bring some solutions.
Hi everyone, Gianni Micucci from McGill University. First, thanks everyone for your presentations. I think this question would be more for Benjamin, but happy to have anyone's thoughts on this. I particularly like your life lessons, the one about strive and work hard and results you will achieve. I was wondering if you had any comments or thoughts on countries like France, who recently decided to actually go backward on those ULEZ and decided to cancel them for economic reasons. Thanks.
Great, thank you very much for that question. It is an important one. So while I don't want to contradict myself, because I said that mayors are really, really important for these things, and when a mayor changes, then the political situation can change. But actually, that doesn't necessarily mean the fleet changes, particularly in the case of goods vehicles, commercial fleets. The investments need to go in well above time, and fleets need to be purchased well, and then they need to be operated. So what industry like, and we hear this over and over again, is they want certainty and consistency, so they will plan ahead. So if you get a sudden change like that, actually you'll find that much of the fleet will continue along the trajectory that they've already planned. The tricky bit is people who relish the opportunity to do something that they hadn't been allowed to do. I don't have direct experience of this, but I would expect that that's a relatively small proportion of the fleet in terms of emissions. I think there's some interesting differences when you're talking about things like low emission neighborhoods. So these are areas where the main aim is to get vehicles off the street, and these are much more subject to sudden change, and reversal of them can cause a rapid increase in the vehicles on the street. So I think in those cases, you really need to, even more, you need to keep the community involved. And perhaps that is a situation where it may be that the civic mayor wants to change a policy, but the neighborhoods themselves want to keep the policy, and then they're able to, with people power, sort of say, no, we want a low emission neighborhood in our community. So yeah, be prepared, be aware of what's going on, and try and create an infrastructure which is resistant to shocks due to political change.
Thank you.
Before we move to the next question, I'm just going to ask a tangential question related to the last one. Is for our panelists, you know, we've seen changes or stepping back from federal policy on several regulations. And so just curious on how we should be thinking about applying accountability research to study those impacts, and how we might be able to document those maybe health impacts from those policy rollbacks.
I guess from the modeling world, we're already doing that, right? Like if you flip our scenario, the counterfactual scenario to the real scenario, in some way we're accounting for the foregone benefits. For the health part, I'll defer to, yeah, but I feel like it might be more, because you don't know how long these policies will last. I don't know.
Yeah, I mean, I guess I think that's, you know, if we think about our current approach that we're taking, if we can somehow estimate the emissions that are being changed due to rollbacks, then we could maybe continue the calculation down the chain. But without that information, you know, kind of depends on how much information we have about the rollbacks. So.
Yeah, no, I just thought your presentations on the counterfactual might be a way to try to understand the potential impact. So just wanted to bring that up because I know it's something that many in the room are considering right now. We'll go over here for our next question.
Hi, Mike Jarrett from UCLA Fielding School of Public Health. I just want to make a cautionary note here. I don't think we can put too much on these accountability studies because real life often gets in the way. And one example would be the Meng study that my now dearly departed colleague led on the goods movement program that the Air Resources Board in California implemented. And it was very carefully designed. We had a lot of field data that we could draw on, but the policy was implemented in 2007, 2008. What happened in 2008? There was an exogenous shock. We had the biggest recession in 100 years, or 70 plus years. So another study I did, we measured hundreds of people for physical activity, hoping that a new bike study program, like a bike sharing program, would increase physical activity in the students around UCLA. And the same week that we began our study, and started implementing it, the Bird scooters came out, and we actually detected a decline in physical activity among the students because they were all riding these scooters and not riding bikes. So I think Ben's point is very well taken, that there can be these unintended consequences. So I think we still are going to need a broader base of evidence, and regardless of what the current Case Act head says we need, we are going to need more buffeting evidence from other types of studies. And then, looking into the future, I think all of the studies were outstanding, the ones presented today, but they all had, informational gaps that were huge, right? The first, from working with Frank Kelly and talking to him quite a bit about those first studies on the congestion zone, there just wasn't the monitoring there to really support an effective evaluation of what was really happening. Or we have to resort to models, which are great, but they have their own questions and limitations. So my question to you is, what data infrastructure, either health data or environmental data or better integration of data through machine learning, through artificial intelligence, do we need going forward to avoid those informational gaps that often lead to questions about the validity of accountability studies?
That's a big question. I don't have the answers necessarily, but I do feel like data availability is our usual challenge in most of our research. And in accountability in particular, I think that if we're coming to an era of big data, whether that's in combined data sets from satellite remote sensing and ground measurements and having a complete picture, there's a possibility for machine learning to be able to synthesize all that information and kind of help us understand where changes are happening, where something should be investigated. So I think that's maybe something that could be coming up. I'm not sure if we're there yet, but I do feel like data health outcome data is usually protected, so how would those feature into these kinds of models would be challenging, I think. But data availability in general is a challenge. It's a good comment.
I agree, it's a really good comment. And just want to add, I feel like the availability of low-cost sensors also provide additional data sources and spatial coverage. And personally, I'm also interested in the indoor versus outdoor air quality. Like, how do you assess the actual exposure of people? Because most of the studies are conducted based on ambient air quality. Just some thoughts, but really good comment.
Would it be wrong to end this session on social science? I really think behavioral data. You mentioned about the bikes. That's behavioral science, understanding why people behave the way they do. And I think we need to, we know we'll have a greater volume of data to deal with in future, but qualitative data is also important, and we need to not forget the behavioral side.
Yeah, I could add one other model that I think was very effective was through the PASTA study, which is physical activity through sustainable transport in Europe. And that was led by Audrey Denazel and Mark Neuenhausen. It basically set up 7 cohorts in major European cities that were intended to be there when new infrastructure was put in place. And we may have to start thinking about those kinds of investments if we really want to get at these questions, so that we have the health data that's there and the measurements before and after going forward. So it's partly environmental, but it's also on the health side. Thanks very much for the great session.
Thank you. We're going to close this part of the session now. Apologies for this. We're out of time. But first of all, thank you very much to all our speakers. If we could give our appreciation again.